Hi everyone, Nurse Yalda. Welcome to our session. For my lovely patient, we are doing some neck rejuvenation. It is very important to really focus on the patient lower face, their anatomy, and what can we do as a clinician to help them to improve the quality of the skin and overall. So one of the treatments I'm going to do for my patient is relaxing the platysmal band, especially as we become more mature. Our platysmal bands becomes more noticeable. The reason for that is the skin gets thinner, we lose collagen, and those bands becomes extremely noticeable. So how we can treat those is by placing about 20 units of toxin per band. Some patients has more dominant platysmal band, more medial. Some of them is lateral. So for her, we're doing about 20 units per band, mainly her lateral platysmal bands. And then the second thing I'm going to do for her is treating the horizontal line. That is going to be the micro toxin, and it's going to be little drops of toxin between the lines to go ahead and rejuvenate and make those lines softer. So in summary, lower face is important. Your platysmal muscle pulls everything downward, so we want to go ahead and relax that. Otherwise, by injecting everything at the top, we are going to ignore the lower face, and the lower face muscle is always depressor, so therefore it's going to compensate, it's going to work harder, and we want to make sure we treat the face like a clock. So lower face is super important. All right, so I'm going to show you guys how I do that. Make sure the area is nice and clean. I'm doing 1-to-1 dilution for my patient. I know everybody has a different dilution for their toxin. So I'm using a Botox, and so relax your muscle completely. And now go ahead, just say E. Excellent. So for this, and now go ahead, put your head down actually, and say E one more time. Perfect. All right, guys, so straight to the band, between 2 units per injection. And she should see an improvement in the next 4 to 5 days. Go ahead and relax. All right, and go ahead, stretch your neck again so I can see the bands really well. So you want to grab the platysmal band. As I say, it's a 20 units total per band, and this is going to help to stop this band becoming noticeable. All right, so let's do the second one. So go ahead, turn all the way this way. All right, say E. All right, guys, like that. We can go ahead and grab the muscle. And I'm going to go to the other side so I can have more. All right, go ahead and relax for me. Say E. Awesome. So grab the band straight, 2 units, small units of Botox. And this was another 20 units to treat the both band. So if you go ahead, hand me now the other syringe. Thank you. All right. So go ahead and look down for me. So the 2 horizontal line usually happens when we're looking down. This treatment, it's going to smooth this line for her. And you want to educate your patient. Every session, every 3 to 4 months, when the patient gets these lines treated, the line's going to become more and more softer. But in order to really tighten in the skin, one of the treatment that you can suggest to your patient is energy devices, skin tightening to bring the collagen back. Hyperdiluted radius is another favorite treatments that I do use. So basically, we want to really treat it as a combination of a great medical graded skincare, toxin, skin tightening, and biostimulator to rejuvenate the skin. Hi everyone, Nurse Yalda. I want to thank you guys for all your love and support and following our YouTube channel. So just to let you know, for more information and having the full access to these videos, you guys can click on this link, which is Nurse Yalda Virtual Platform. I have all the educational video that you guys need for running a successful practice and being a better provider, a safer provider at Nurse Yalda Virtual Platform. I'm so thankful and excited for all the love and support.